Hi, I'm Matt Rosetta, the CEO of N6A, and this is Essentially Heroes, where each day we're speaking with a different essential worker who's on the front lines battling against COVID-19. And today's guest is Dr. Grant Hubsher, a very special guest. Dr. Hubsher is an emergency medicine physician at New York-Presbyterian Hospital, or as I remember it from when my three daughters were born there, Dr. Brooklyn Methodist Hospital. Doctor, thanks a million for being on our program here today.
Yeah, definitely, Matt. Thank you so much for having me. It's a great program that you have going on, a great series.
So, Doc, tell us a little bit about your job first, and then we'll get into what the experience has been like on the front lines.
Yeah, so I'm an attending physician in the emergency department, so an emergency medicine physician. And so we're constantly seeing patients that come in for all types of emergencies. But right now, over the last month, it's really been a lot more patients that are coming in for cough, fever, shortness of breath, primarily as a result of COVID-19, for the coronavirus.
What's the experience been like with your coworkers and with the hospital workers? I'm assuming everyone is really coming together. We were talking about it offline, and this has been an opportunity for everyone to really galvanize, right?
Yeah, absolutely. Everyone's really, ever since it's really hit the hospital, there's been a lot of push in order for everyone to come together. So the doctors are working with nursing, who's also working with the inpatient team. And we're really trying to do our best to care for these patients. And the hospital administration as well has really, taken it upon themselves to try to open up some more space for these patients, because we're having a lot of patients requiring oxygen or requiring a ventilator. So we're increasing our ICU, and especially in the emergency department, we've expanded the emergency department so that we can, see more patients and separate patients as well in private rooms as best as we can in order to, help decrease the spread of COVID-19 amongst the patients as well.
What's the traffic been like in the hospital? The foot traffic, I'm assuming. We're getting into peak days now, so I'm assuming it's increasing by the day.
Absolutely, yeah. The traffic's been increasing a lot. Every day we're seeing hundreds of COVID-19 coronavirus patients, and each day the acuity of the patients is becoming more and more severe. So a lot more patients are becoming more ill than the day before, and so we're having to intubate and put patients on ventilators a lot more frequently with each day.
Well, Doc, you guys are the real heroes right now. So just what can we be doing as a public to do a better job to help you, to keep you safe, and most importantly, to help everyone in this fight against COVID?
Yeah, absolutely. It's it's really great that everyone's been showing their support for the healthcare providers. I think myself and everyone else on our team is really appreciative when we feel the support and we get these thank yous and even donations for meals. It's always been very nice, and everyone's staying inside. Everyone's, even if you're not on the front line or you're not working and treating these patients firsthand, by helping to decrease the spread and decrease the stress and the abundance of patients that come to the hospital all at once, it's really making a lot more efficient for us to treat the patients. So it's really definitely helping, and a lot of patients are still coming in as it is, but it definitely could be worse if everyone was still out and about, and we would probably see a lot more.
Amen. Doc, what are your hours like lately?
Yeah, so everyone's been picking up some more shifts. So in my hospital, we all do like 12-hour shift work. And so instead of working our usual shifts, everyone's increasing 3-4 additional shifts of the month, with a mix of overnight shifts and daytime shifts, and just kind of mixing around. And unfortunately, coronavirus has gone through a little bit of our department as well. I actually myself was sick just 2 weeks ago with coronavirus as well, and had to be out for a little bit, as have several of our emergency department residents and other attendings and some nurses too. So one of the things that we're really also doing is making sure that enough of us are healthy and can fill in for each other when some of us get sick. So I was fortunate enough to not have anything too severe that I required an inpatient stay at a hospital, but I still had to rest at home, and we really have to make sure we're there for each other to fill in when people do get sick.
So, Doc, you tested positive for the virus, you said?
I did. I tested positive for the virus a little bit earlier on. Just a couple of weeks ago.
Could you just tell our viewers just kind of what that experience was like? I think you said the symptoms weren't as severe as some of the others, but still, I'm assuming that was obviously a trying time for you.
Yeah, absolutely. Being around coronavirus patients so frequently, I kind of wasn't so surprised when one day I woke up and I just had, extreme soreness in my back, feeling like I just did like a large workout the day before when I didn't do anything. And then the following day, woke up with like a low-grade fever and noticed that I couldn't smell. I lost my sense of smell. Wow. And so pretty quickly I knew that, this is most likely from coronavirus. So I called up work and let them know that I should get a test before returning to work so as not to infect, my colleagues. And I got a test and took a couple of days off and it came back positive. But fortunately, I didn't end up having any symptoms of like shortness of breath or things like that. So I was checking my temperature pretty frequently, as well as my oxygen levels and making sure that fortunately I was able to, be okay staying at home.
Well, thank God you're back to 100% now and it's all fight the good fight.
Yeah, exactly. So, it's a very contagious virus. So it's not uncommon that it's going to make its rounds through the population and especially through healthcare workers.
Definitely. So Doc, when does your next shift begin?
I actually just got off a night shift just before, and I'm going back to work again in about 10 hours now. Having a 12-hour break and then back to the grind. So. Well,
tell us. I know the area you work very well, Park Slope down in Brooklyn. I said my 3 daughters were born there, so there's a ton of great choices in terms of food and restaurants and stuff. So the least we could do is take care of you and your crew, and we'll make sure you get a great hot meal delivered to you next time you show up for your shift.
Yeah, that's so kind. Yeah, everyone's been really really kind in their donations, and it's been really nice to see the pouring out of generosity from everybody else.
Definitely. Do you have a favorite local place to eat?
I live in the Lower East Side, so I kind of, eat a lot of places. I know Sauce Pizza has actually been donating pizzas very frequently, and so it's been very appreciative. Yeah.
Well, we're gonna fill you with even more pizza then. We'll have a double order of sauce to the ER.
Oh, perfect. Yeah, it's really good food.
But seriously though, Dr. Hubsher, on behalf of my company N6A, on behalf of New Yorkers, Americans everywhere, you're the true heroes right now. So we just wanted to say thank you. I think the whole country really now more than ever owes people like you in the healthcare profession an incredible debt of gratitude. So keep making us proud. As we like to say at N6A, keep fighting. And we're rooting for you and praying for you from behind the scenes.
Well, thank you so much. Thanks for having me, and COVID strong. So we'll be good together.
Thanks, Dr. Hubsher. Appreciate that. Dr. Grant Hubsher from Brooklyn Methodist Hospital. Thanks a million for joining us today. Be sure to join us tomorrow for another episode of Essentially Heroes with another heroic essential worker who's on the front lines battling on behalf of all of us in this fight against COVID-19. Dr. Hubsher, thanks again. Stay safe out there for us.
Thanks, Matt. Thanks for having me.
Appreciate it. Take care now.
Bye-bye.